Hello, my name is Lucia Vasquez-Padilla, and today I will be talking to you about marijuana. So what is marijuana? Marijuana has the scientific name of cannabis. The United States Drug Enforcement Administration website schedules marijuana as a Schedule I drug. A Schedule I drug is a drug that has no current acceptable medical use and has a high potential for abuse. Marijuana refers to the dry leaves, flowers, stem, and seeds of the plant. There are two types of plant strands, cannabis sativa and cannabis indica. So cannabis sativa is supposed to cause a head high and it has uplifting and euphoric effects, whereas cannabis indica causes a body high and is supposed to relax the body and stimulate an appetite. One interesting fact about marijuana is that it has over 200 street names, such as weed, Mary Jane, ganja, etc. THC is one of the most known chemicals of marijuana. It is also known as delta-9 tetrahydrocannabinol. It is a primary psychoactive, mind-altering ingredient that causes the euphoric effects. Cannabis is such a unique drug because it cannot be classified as a specific drug group, because it can be a stimulant as it causes euphoria or paranoia and increases alertness, attention, and heart rate. It can be a depressant because it causes drowsiness, it can calm nerves, relax tense muscles, and lower inhibitions. Or it can be categorized as a psychedelic as it can alter perception and cause delusions and loss of sense of personal identity. Here is a chart that breaks down the differences between sativa and indica. Marijuana as medicine. The U.S. Food and Drug Administration, FDA, has not recognized marijuana as medicine because there has not been enough large-scale studies to show that the benefits outweigh the health risks. With that being said, there are ongoing clinical trials to see if marijuana can help certain diseases and conditions such as HIV, AIDS, multiple sclerosis, epilepsy, and seizures, as well as inflammation and pain, substance use disorders, mental disorders, and if it can help people who are ongoing through chemotherapy or have eating disorders. There are different forms of consuming marijuana. It can be smoked, inhaled, or eaten. So the different types and forms of consuming marijuana are through joints, blunts, bongs, dabs, or edibles. Here are a couple images that display the different forms and types of ways that marijuana is used. So the effects of marijuana. So marijuana has both physical and mental effects. The physical effects are greatly seen in decreased coordination, reaction time, sensory perception, and concentration. Whereas mentally, the memory is impaired, perception is altered, and the state of euphoria is created. The state of mind and moods can change, ranging from happy to sad, sad to happy, etc. 4 out of the 5 senses are increased, such as sight, sound, taste, and touch. Depending on how much marijuana is consumed, people can also have hallucinations. So the effects of marijuana are short-term and long-term. The short terms are typically the effects that are seen during the high stage, whereas the long-term effects of marijuana use can increase the heart rate of a person and even double it over time, increasing the risk of a heart attack. Respiratory issues develop and affect the lungs and breathing. There is also an increased risk of mental health problems like depression and anxiety. If smoking during pregnant, the unborn baby is subject to being premature, have a low birth rate, and there is an increased risk of behavioral problems in the child when growing up. The side effects and risks of using marijuana are typically having a dry mouth, dry eyes, bloodshot eyes, puffy eyes, increased heart rate, eating binges, aka the munchies. And one of the biggest questions is whether marijuana is addictive or not. Since marijuana is one of the most used illicit drugs, the Center of Disease Control and Prevention states that about 1 in 10 marijuana users will become addicted, and 1 in 6 users who smoke before the age of 18 will become addicted. So, does marijuana have withdrawal symptoms when trying to quit? The answer is yes. People can experience grouchiness, sleeplessness, decreased appetite, anxiety, and cravings. So, statistics and trends of marijuana usage. As you can see in this chart, there has been a decrease in cigarette usage among teens, but marijuana usage is at its highest. That is due to a reduced perception of harm in marijuana usage, as there are continued debates over the drug's legal status and medical validations. Some teens view marijuana as safe because it is a natural plant, but people have to remember that other drugs like tobacco, cocaine, and heroin also come from plants. Interesting facts about cannabis. Cannabis has both female and male plants. There are also over 421 different chemicals in cannabis, and 81% of U.S. adults in the United States believe that marijuana had at least one benefit. And here are my references.